Two boys, Michael and Joey. They like to play and do things that all kids like to do, except they have one other unique trait in common. They both are autistic. Autism is a brain development disorder that affects 1 out of 150 kids. Autistic children have difficulties with social interaction, problem with verbal and nonverbal communication, and repetitive behaviors or narrow obsessive interests. These behaviors can range in impact from mild to disabling, all starting before a child is 3 years old. Currently, the Autism Society of America estimates that the lifetime cost of caring for a child with autism ranges from $3.5 million to $5 million. This is the story of their parents' efforts to receive help from their insurance companies and some Wisconsin state legislators, in particular Samantha Kirkman, Assembly Representative from District 66. Kirkman was asked to support Assembly Bill 417. This bill requires health insurance policies and self-insured governmental and school district health plans to cover the cost of treatment for autism.
Our son Michael was 2 years old, and he was not talking. He had almost no speech at all. So we took him to our family doctor. We started out at about 18 months. I knew something was wrong. And we went to our family doctor, who of course told us that a lot of children don't talk until they're 2 years old, kind of a wait and see approach. Took him back for his 2-year checkup, and again, he still wasn't talking, and I noticed a lot of different lags in his development, especially in comparison to our older daughter. And again, was told, take a wait and see approach, see what happens. But I knew something was wrong, so I got him in the Birth to 3 program. He went through speech therapy, started out once a week, went to twice a week. He wasn't making any progress. Birth to 3 only, goes until 3 years old, at which point they told me that they thought he may have autism. And I took him to WEAP, which is the Wisconsin Early Autism Project, and got him tested, and he was diagnosed with autism. And we got on the waiting list for him to get state funding for his autism therapy. At the time that he was diagnosed, he was 3 years, 3 months old. He had a full-scale IQ of 53. He presented as a 19-month-old with verbal skills at 9 months. At that time, there was about a 6 to 8 month waiting period to get into the program. He started therapy the following February, after his wait was over, right before his 4th birthday.
Now, how was your representative to you beyond just suggesting that you should read a book and become a psychotherapist?
She also offered, again, through our conversation, and I was trying to tell her about what therapy has meant to Michael, what it has done for him, and the difference that I have seen in him, and other parents that I know who are also in this type of therapy, ABA therapy, called for Applied Behavior Analysis Therapy, and what it has meant for their children. And she offered to come to my home and watch therapy. I told her that she needed to get a little bit more educated on what is required in therapy before she could, come up with the idea that maybe parents should just do it themselves. And she said that she would be happy to do that, and that she would call me and come in the next week or so, but unfortunately I haven't heard from her again.
Oh, when was that?
That was February 19th.
And I think it's appalling that anybody could even suggest that you could, homeschooling and then being a home therapist are two different realms. These are professionals, and it's like for a person to pick up a book, and the thing is that even if they were able to, with the time constraints that most families have nowadays, most families, 2 people work, we're lucky enough that just I work, my wife's a stay-at-home mom.
And how many jobs do you work?
I work 2 jobs so that, we can afford to do this.
Michael's parents are not alone in their battle to gain insurance coverage for their son. They are joined by Sonia and Bill, who are fighting in vain for financial assistance for their son Joey's therapy.
He was diagnosed with autism, and We were told that he needed intensive ABA therapy, and we were told that he needed it right away in order to increase what he could do in the future and how much progress he could make really depended on how quickly he could get into this therapy and how intensively he got this therapy. And our insurance company denied his coverage in anything related to autism. So what they told us was that it was medically unnecessary to treat any individual with autism. So we were in a bind and we asked, what do we do? Representative Kirkman she did seem helpful at the time. She did come and visit us in our home and Joey in our home. But when I asked her if she would support the Senate Bill 178, insurance for children with autism, she said she didn't believe in mandates. So, being a parent with a disabled child, you would think that your state would put children first beyond anything else. Children should be first. They should be cared for first. And it felt like our child and all of these children with autism were left to fall through the cracks and no one cared. So, we waited for his state waiver funding for his autism treatment for 8 months initially. And then in April, when we expected his funding, the county wrote us 3 times and delayed his funding 3 times. So that's when we got Representative Kirkman involved, and I guess it was just because of the huge number of children. This is an epidemic. Autism, 1 in 150 children are diagnosed.
They're basically metering the children into the program. They have enough funds for 200 children. So as a child ages out of it or has reached the maximum time they can be in the program, which is 3 years, a new child can come in as one goes out. So they say it's very difficult for them to figure out how to do it, and I disagree, because if you know when they started and you know the maximum time they're in, you can easily tell parents where they're going to be expecting their waiver funding to come in, especially parents that are paying out of pocket. We paid $600 a week for 14 months.
It's already been proven, I guess, in Illinois or Indiana, Illinois, Wisconsin, that the coverage for this would be roughly $4 per month.
That's it.
Per premium. That's it.
It's 0.5%. It would cost 0.5%
And
of
then
an
your,
increase.
and your kids would be covered from birth to
18.
18. Oh, to life.
Well, life. That must
Yeah.
be lifelong.
Yeah,
So
for $4.
for $4.
$4. I think it's more to protect the insurance industry.
You follow the people opposing it and where
You follow the money.
these people are getting their contributions from, their campaign contributions.
Well, where are they?
So, if you look at some of the senators that voted
please.
against this, insurance, $30,000 insurance.
Who's that?
Mary Lazich, insurance, $21,000.
Despite the efforts of many families, the Assembly Majority Leader, Republican Mike Hubish, fearing that Assembly Bill 417 would actually pass, saw that it never came up for a vote. Representative Kirkman could have done the right thing by fighting for Wisconsin's autistic kids, but she didn't. We have to ask ourselves, is this the type of representation we want?